and the moderator. I would request all the panelists who have joined the session to kindly unmute yourself and switch on. If you can also kindly switch on your video and say hi or hello. Hi, hi. Am I audible?
Yes.
Hello.
Hello, everyone.
Hi.
Good evening, everyone.
Hi.
Good evening, everyone.
Good evening.
Good evening. Good evening.
Yeah, Marin, sir, am I audible to you?
Yes.
Okay, thank you.
Shibu, nice to see you.
Nice to see you, Demern.
Kelly, hello. Am I audible? Kelly, you are not audible to me. Is the issue with me or hi?
No, even we can't hear her.
Okay. I guess. Oh, Kelly, if you can reconnect to the session again,
Yeah, maybe audio is not.
maybe that will help. Yeah.
Maybe her audio is not connected.
If you can also check if your audio is connected, and if so,
Now I think
and then
yes.
you are still facing the issue, then you can reconnect back to the session.
Now you can unmute. It will work. Yes, now it will work. No, it's not.
No,
Still not.
still.
Maybe, ma'am, you can try connecting some earphones or something like that.
One of our panelists is yet to join us. He is facing some issue. I believe he will join us very soon. As it's already 3 p.m., we should start the session. Though, before that, have Kelly joined? Kelly, if you can please unmute yourself. Miss Kelly, if you can please unmute yourself. Hello, Kelly, Miss Kelly, am I audible to you? If you can kindly unmute yourself. I believe Miss Kelly Jano is having some issue with her microphone. So I request each and every one of you to kindly bear with the inconveniences, and we shall start the meeting in 2 minutes. Our moderator is having some issue with her microphone. She is trying to fix the issue. In the meantime, we shall start the session. Very good evening to each one of you. I would like to welcome you all to our COVID-19 academic session. Today we have a very important session on the child health and safety of children. Health and safety of children during the current surge of COVID-19. It is a collaborative session of Nagaland COVID-19 Academy, Spare India, and Nagaland State Disaster Management Authority in partnership with UNICEF, WHO, HCL Foundation, and World Food Program. Once again, I welcome you all to the session. And today for this session, we have a very eminent panelist from the state of Nagaland. For the introduction of the panelists, I will hand over it to the moderator. But before that, let me give a brief introduction of our moderator today. He is Miss Kelejano. She has completed her master's in social work, specializing community development. She is now currently working as the data entry operator at NSDMA. She is having some issue. So instead of handing over the time, let me just proceed. In the meantime, she might join us. We have the first panelist, Miss Dr. Longri Kichu. He is a UNICEF representative. He has completed his MBBS from Rajasthan University of Health and Science, Jaipur. He did his Masters of Public Health and PH Epidemiology, Health System, Urban Health, National Health Programs, Health Policy, etc. from Jawaharlal Nehru University. Currently, he is the public health specialist working as consultant to UNICEF in maternal and child health. Next, we have a resource person, Dr. Apong Longchar, DCH, MD Pediatrics, and he have done his DPA from Sri Ganga Ram University. Currently, he is the consultant pediatrician, certified pediatric allergy and asthma specialist. We also have panelists from Childline Nagaland, who is none other than Mr. Subunen Balongkumar. He is a nodal officer of Childline Nagaland and also a GB member of Childline India Foundation. And we have Mr. Meren Nampui from World Vision India. He is the Senior Manager, World Vision India, Northeast Zone, Guwahati. He has 20 years of experience in various capacity, providing leadership in World Vision India projects in India. One of the projects is Health and Nutrition Project, Dehradun in Uttaranchal, HIV and AIDS Project, Ajmer and Jaipur in Rajasthan. He also have the World Vision also have done a project on polio eradication initiative in the state of Uttar Pradesh, based in Delhi. And currently, World Vision India have been undertaking projects in the state of Nagaland, particularly in the state of in the district of Longland. So today he will be sharing his experiences based on the practical experiences, basing on the projects that the World Vision have been undertaking in the state of Nagaland. So okay. So before I hand over the time to Kelly Jano, Kelly, if you can unmute your mic.
Yes. Am I audible now?
Okay, yes, it's very much. That's great. Now I would like to hand over the rest of the time to our moderator, Kelly Jano. Over to you.
Okay, thank you, Ms. Sonny. Good evening, everyone, and welcome to today's session, Health and Safety of Children During Current Surge of COVID-19 Nagaland. hosted by Nagaland's COVID-19 Academy, Sphere India in collaboration with Nagaland State Disaster Management Authority. Okay, so before we start, I would like to introduce our first panelist, Dr. Longri Kichu. Currently, he is a public specialist working as consultant to UNICEF in maternal and child health. Today, he will be addressing us on the psychosocial and mental health of the children and vaccination and children. Sir, you may take your time.
Good afternoon, everyone. My esteemed panelists, participants, since we don't have much time, I think we get 15 minutes, right? Or 10 minutes. What is the time we have? Okay, then. So I'll have a small presentation. In the presentation, I'll be talking about the situation in Nagaland, the COVID situation in Nagaland. And then I'll take you through the things that children face during this pandemic and the way forward. And also, of course, we will talk about vaccination, which is very important in this phase of the pandemic. So do I run the presentation from here or from there? Shall I run the presentation?
Yes, sir. Yes, Sir Longri, you can share your screen.
I hope it's visible today. Last time it's confused.
Yes, it's very much visible.
Okay, if the slide don't move, please let me know, okay? Sometimes you get stuck, right?
Sure, sir, we'll do that.
So health and safety of children, it's a big topic. I think it will take the whole week which we talk about this, but I'll try to make it very small. First, we talk about what has happened in Nagaland over these last few days. I mean, last months. Schools have been closed for 74 days. Lockdown for around almost 60 days in Upper Kohima. These are things that happened because these were important to control this pandemic. But then because of these things, I mean, children have also faced the brunt of all these lockdowns and all these things. So these are things we have come across. We talk about the cases in Nagaland now. It's on a decline, we know that, but it's not over yet. After lockdown, the cases have declined from around 2,000 per week to 600 in a week from last week. But I just want to say, things are not over yet. We have to be very vigilant. We have to be very, cautious of this. So we have some concerns regarding this pandemic. What's happening in our state is in Dimapur, Kohima, we have seen cases are declining, but districts like Peran, Bangsang, Begs, and Neboto, some districts are showing an increase in cases. Simple positive rate of Kohima Mokchong is more than 10%, and those cases have been reported from villages and all this thing. So that's a big concern. Obviously, all over the world, we have a big concern with these variants of concern. The Delta, Alpha, Beta, Gamma, Delta, and all these things. So Delta is a big concern right now. And one very important thing is our fatigue. We are all tired. We don't want to wear a mask. We want to stay, we don't want to stay at home and all these things. So these are dangers for a third or I don't know, fourth, fifth, which way, whatever that's in line. We don't know much. So, and one important thing is our low vaccine coverage. So these are concerns we have. So how do we address such concerns regarding children? So how do we protect our children during this pandemic? I mean, it's simple as this. I mean, it's up to us, the adults, the parents, the seniors, right? The elders, how we behave. So protecting our children will be up to us, how we behave during this crucial, critical time. From today, we are entering a very critical phase in our state. Many activities are being unlocked because we cannot go on a lockdown forever, right? But I want to tell you that the threat is still very high. COVID cases will come up anytime, as long as, anytime we are lax in the behaviors, okay? So it does. So we are talking about the third wave or things like that right now. We are very concerned about this. So with the third wave, it rests on two important things. One is our vaccine coverage, the biological vaccine. Number two is our social vaccine. How do we behave when we are outside our social gatherings, our crowded places, everything. So these two things will determine how the third wave will be. So we have to keep this in mind. So I'm just giving you what's happening in Nagaland because we have to know this. These are very basic things, but we have to know this to understand how we protect our children also. So the most important things are the 3 C's, okay? The crowded places, closed spaces like offices, homes, churches, and all these places. And these are places where we have to be very careful. So in Nagaland, if you look at our infections, most infections have actually happened in your own households, within family members, okay? And one thing we have observed this time is people doing, people making unnecessary home visits, getting the virus from someone, from relatives nearby, from some colonies. Even if there's a lockdown, it will help no koribo if you continue doing all these things, because closed space, office, it's more dangerous than an open space, right? Our second, important office office this week July brana. So we have to be very careful in such settings so that you don't take the virus home to your family. Okay. So the way out is, please avoid crowded places. Social gatherings we are still not out of the woods yet. We still have a long way to go. It will keep up in offices, in your homes, please be careful. So these are things now which we can protect ourselves and our children. So one very important thing is, of course, the mask. Everyone knows about this. We are talking about it every day, but we cannot let go of this. I'm not wearing a mask now because I'm staying alone. I'm alone right now. But once you are out of this thing, your houses, you have to wear this. Children 2 years and above can actually wear a mask. It's quite safe. I mean, it's no issue there. So now we are recommending this double masking. Inside you wear a triple layer mask and outside you wear a cloth mask. So it gives around 85% protection as per a study. So if you just wear the cloth mask, it's 20 to 50% effectiveness, right? So a double mask is the way forward right now. N95, we reserve it for healthcare workers. And one thing we are very concerned about in our state is our testing is very low because people are not coming forward. If you have fever, it's a pandemic. Fever, you have to get tested. I mean, in a pandemic, we have to suspect every fever, every cough, every flu case and all this. Unless you're tested, we won't know. You'll be fine, but you'll transmit the virus, someone else will die, right? So we have to know this. Test. We have to, I hope we are doing this. So coming back to children, we know how to protect ourselves now and the children, but this mental health crisis among children is a pandemic which was ignored in India also, in the world actually. So this was heading by the Indian Journal of Social Psychiatry. I'm not much into this mental health thing, but whatever we have, I share this information. So mental health crisis was never talked about. We have to talk about it right now because it's like a pandemic. It's just another, we are talking about healthcare workers, we're talking about frontline workers, but no one has talked about children. So it's very important we have to talk this right now. So a UNICEF study has said that, children, they do well when everything is fine at home. They feel safe, they're protected, they're happy, they're going to school. But once, in the pandemic, in a disaster, these things are disrupted. So they're just locked on, the schools are closed. So this impacts children to a huge extent. So a study by some group in India has given us some very astonishing results. It says that almost 80% of children showed some psychological symptoms related to COVID pandemic. So we have to be quite aware of this. 80% is a huge number. Only 20% were safe from all these symptoms. So 80%, I'm not saying 80% were in depression or a big mental health issue, but 80% also showed some psychological symptoms. So just to know that, I on the right side, there's a very important graphic from UNICEF India. How do I know my child is going through psychological distress? I have quite shared this with many people, but this is very important. These are very simple things. Just look out for such signs in the children, okay, in your students or anyone. So change, weight can change Korea, say sleep, no Korea, disturbance in sleep patterns, no combine. Arotai is always like is always looking sad, in the Kabiase. Aropila Tiki he was interested in so many things before. Now Itiadotai is not interested in doing things, the same things again. Aro self-esteem komti. There's a feeling of hopelessness. Aro kumbado all of younger adults, all of teenagers kind of suicide thoughts can be. So we have to look out for such symptoms in the child. So this is very important. So how do we help children deal with this big stress? Even we are so stressed. What about children? No, we don't know. You're not talking to us, so we don't know what's happening inside their minds and all this. So, I mean, in our society, we don't. I think many families don't talk much with the children. Also, we have. I mean, we're not. Our society in Naga society is quite like that. So, the thing is very important right now is we have to listen to them. We have to actually talk with them. You know, I mean, how the children. You know, what are you feeling? I mean, we have to make this talk with children. We have to make them share, right? So they have to be comforted by us. We have to talk with them every day, and we have to reassure that everything will be fine and all these things. But we need to start talking with children during this pandemic. So, like we just say, virus, so we have to actually talk with children regarding this virus also, this pandemic also. Virus to say, how is COVID? In a language they can understand, right? We have to be truthful also. We have to be with the facts. So the thing is, let's at least start talking with the children. So that's a very big step forward, right? An example, this is from UNICEF India. So they have given some activities which the child can be engaged, right? Get up on indoor activities, exercise. So I think it's good to keep them busy in this way in a safe manner. So these are just examples. So that's one thing we can talk, one thing regarding the psychosocial and mental health. Now we come back to the unknown, the long-term effects of the pandemic on children. It's quite scary if you look at the data now. We are estimating that around 6 to 7 million children will suffer from acute malnutrition or wasting or even stunning and all this in the later stages. 80 million children will miss vaccines, which is so important for a child against very vaccine deadly diseases like measles, diphtheria, and all these things. So 80 million children will miss COVID because of this pandemic. Our micronutrient deficiency like vitamin A, iron folic acid coming in the we give this in schools, we give this in Angoni centers, we give this in the community and all this. Now, economic disruption whole party. And one scary data is maybe more than 124,000 children will be infected with HIV because one is maybe we could not give the ARD drugs to the mothers or the parents, or some diagnosis were not there. So these are quite scary figures. One very important thing is the mental health disorders in a person starts before the age of 14, and it's a very vulnerable stage for any child. So if we don't take care of them right now, maybe it can manifest later. We don't know how it will manifest, but it could manifest. So we have to take care of this. And one very important thing is the school. 24 million children school children might drop out of school. That's so scary. We are losing generations to this pandemic. So closure of schools, not just about education. School miss out on physical health, support network, friends. So mental health be stress. In Nagaland, we are very worried about this urban-rural divide, especially during this age of online learning. In Nagaland, the children in villages, in the first place, they were deprived because of quality education, lack of quality education. Second place, nutrition worse than the urban areas, like iron deficiency and all this. Now this pandemic came, right? And then many people don't have access to this online learning. Now the divide will be so much. I mean, we have to plan for this. How do we catch up with this? So an Indian study has said that in India, 40% of children do not have access to this digital learning or remote learning. That's a scary figure. So these are the long-term effects expected. And very important topic, I'm coming to my last topic. So it's about vaccines in children. So we don't have vaccine for children right now, at least in India. Why? Because vaccine is in very shortage throughout the world. We have to prioritize the high-risk people, right? So children are still the lowest risk of severe disease or death by COVID-19. So you're not prioritized in the early stages. You're still very better than us when it comes to COVID children. So, and children have a very different, profile. Their biological profile is quite different. So that's one thing. But the good news is like the studies now, we want to introduce, Canada has introduced for 12 plus children. USA has also done the same thing for 12 plus children. The Covaxin vaccine is under the trial in India also for 2 to 18 years. Hopefully it comes out very soon and children can have all these vaccines. And there's a good news from China also. The vaccine is showing very good results in children 3 to 17 years. So there are good news for children in the vaccine side, but till now we don't have the vaccines. So just a snapshot of how COVID has affected the children in our state. Okay, so so confirmed cases below 10 years last year was 3% only. Now it's 4% in 2021. 11 to 20 years was 8% effective cases. Okay, now it's 12%. So there's some change in 11 to 20 year age group percentage. The rest stays the same. So we do have cases in the pediatric age group, like 1 month to 1 year. We have 46 cases in 2021. Under 5 years, we have 159 cases. So under 18 cases in 2020, we had 916 cases. In 2021, it has increased to 1,500 cases. So we don't know what happens in the next week. I know, many data have said that, the severity will not increase in children, but if the numbers increase, obviously there will be more hospitalizations, right? So that's one concern. And the good news is, till yesterday, no COVID deaths have been reported below 18 years in the state, at least in our state. So that's very good news. Maybe I think one is coming today, but till yesterday, we don't have any COVID-19 deaths below 18 years of age. So how do you protect our children when you don't have any vaccines? So this is a big reminder to all of us, parents, your teachers, elders, leaders of society. Please vaccinate yourself first, because you are eligible for it. So you please vaccinate yourself to protect your children, right? And then you maintain all these behaviors, wear masks and all these things. And for the children, there are routine vaccines like measles vaccine, diphtheria vaccine, BCG vaccine, and all this in the market. So you can have the vaccine. The children should not be on such vaccines. And COVID-19 vaccines for children will also come, but only after it has passed through all the clinical trials. We cannot just give vaccines to children or to anyone. So the best thing we can do right now is vaccinate ourselves with the vaccines available to protect our children. So vaccines, I always say this, but the vaccines are the safest way out of this pandemic. Okay. So in a rough figure, around 70% of the population or in Nagaland has immunity by vaccines or through natural infection to stop transmission. Okay. At least 70% of the population should have vaccines or some kind of infection. But right now, where we stand is not very good, because we have only vaccinated 32% of beneficiaries, 32% of beneficiaries, and then 45% of population are children or under 18 years. So we cannot vaccinate them. So the thing we can do right now is at least vaccinate at least 90% of all the eligible beneficiaries. That's like 18 plus population. So that's our way forward. And then when the vaccines come for children, we can vaccinate them, right? So, but right now, as things stand, we have to vaccinate at least 90%. So this is my last slide. Thank you for the patience. So if there are any questions, I'll take, but over to the moderator. Thank you.
Okay. Thank you very much, sir. Hope I'm audible now.
Yes, very much.
Okay, sure. So our next panelist will be Mr. Gundenbal Longkumer, Novel Officer, Childline Nagaland, and also AGB member of Childline India Foundation. He'll be sharing on the distressed children and available helpline number and organizations that provides assistance to children during pandemic. He will also be speaking on the Humanitarian Act to protect life and health of children. Sir, please, time is yours.
Yeah, hello everyone. It's good to see. Thank you, Kelly Zanomiri, for hosting this event today. I thank Sony also for inviting me to speak today. There's a background noise. If some people can just mute it, or if everyone can just mute it, there's a background noise that's really disturbing. I'm so glad today Dr. Longri, Dr. Apong, and Marian is not new to me. It's good to have old friends coming in together for this program today, and thank you all of you. I will just do a presentation. So I'll just share my screen. Where am I? Okay. Okay. So Childline is, I believe many people might have heard about this. The presence of Childline is in Nagaland is, we have been here for more than 10 years. Only this year we have celebrated 10 years anniversary. And I believe almost all of you might have heard about Childline, but it's good to be reminded of the activities and the work that Childline is doing in Nagaland. So in brief, I just wanted to cover what is Childline and how it works in Nagaland, and give you some of the case reports and the studies about, especially that we have come across during this COVID situation. So the footprint of Childline 1098 and how you can reach out to Childline. So actually that's a question that is put up for me to share about how people can reach out Childline, how people can maybe connect with Childline. So I just wanted to share a little bit of that first of all. So understanding Childline. So what is Childline? So Childline is a 24 hours free emergency phone and outreach service for children in need of care and protection. So this is a project that is under the Ministry of Women and Child Development, Government of India. And so Childline is very active, and this is our only, call 109 is the only number in India where people can call, for distress call for children on behalf of the children or even by the children itself. So Childline has celebrated 25 years of existence in India, and we have Childline has saved thousands of children in distress. So it's 24 hours. So anyone can call 1098 24 hours, even in the middle of the night. So there are lots of call that we receive. So I'll also share with you a little bit of how the magnitude and the issues of children that comes to 1098. So anyone can call 1098. It will connect to CCC, which is in Kolkata, with the call center. And so what happened is from CCC, it will go back to the concerned district where there's a team of Childline, in different districts. And that's how Childline, team will reach out to the children. So, for example, there's a call that came up like, hello, Childline, debate me and make me work the whole day. Please come and get me. I'm very scared, so they might kill me. So there's a scary phone call that comes up, and that's how we respond to that. So every phone calls are very, very important, and we are looking forward to reach out more children. So the structure of Childline in the state level or maybe in the district level, so this is how it looks like. Every district has a Childline advisory report headed by the Deputy Commissioner, and the state level headed by the Secretary of Social Welfare. So we have all the government officials in the board, which is why it's very easy many times to get access to different issues and support that we get from the government since it's a ministry project. So we have a very good, strong advisory report in all the districts, and then we are really getting lots of support from the DC level and also from other officers who come forward and help us out. We have a collaborative organization, so you'll see a Childline presence in Nagaland in 6 districts. I will come back to that later on in detail. So we have 6 collab organizations, and they are present in all the districts, especially in the district headquarters. So there are 6 organizations that works in every district. So we have collab organizations, so we have around 8 to 9 members, team members. So they go out, rescue the children, they report back, they coordinate with CWCs and GGPs and with all the especially homes. So they are very active and mobilized and reach out to the children, and they go and rescue the children. They then rehabilitate the children, help rehabilitate the children. So they are the center point for all the issues that comes to 1098. So they are the first people that go and contact the child and rescue the child. We have nodal organizing where CEC is one of the nodal organization in Dimapur. So nodal organization is involved in training, research, networking, awareness, coordination, and documentation. We don't have support sub-center organizing right now in Nagaland. We have resource agencies. So we have lots of resources in here. We have partners, for example, Department of Social Welfare, DCPOs, police. So these are the people who or children homes, and then all the rehabilitation centers that take in children. So, and all the corporates and all that. So these are people and curve of the organization of the body that makes Childline works every day. So that's what happens. So this is the whole structure. What happens if someone called 1098? So the old model that we had before was decentralized. Anyone can call 1098. From Dimapur, they can call 1098. The phone call will link in Dimapur. But right now, what happened is like we have a new model that is for like it has been 5 to 6 years that we've been running the CCC. So CCC, we have a call center, a particularly dedicated call center for Childline and regional, for example, in 4 regional centers, and our regional centers in Kolkata. So from Kolkata, people are sitting there, people who can speak Nagamese, sitting there in the call center. There are a few staff there. So they received a phone call, as in when calls come from 1098 to from Nagaland. So what happens is that you will direct this call to the team members. If someone is calling from Kohima, then the CCC will receive and you will talk, receive. And if it's an intervention cases, then you will direct the call to the team members in Kohima, or maybe in Dimapur, or maybe in Berin, or maybe in other parts of the districts where there's a presence of Childline. And immediately within 60 minutes, the Childline team members will reach out to the child, find the spot, place, and rescue the child and provide shelter, provide assistance, and we give it to CWC. Then there's an intervention, there's recommendation that goes on. So the system is very clear and very easy. So round the clock, Childline team members has been working since last year, in spite of all this lockdown and preventions and insecurity of getting infected. We have this very strong team in the six districts right now, and they are really working so hard, rescuing, protecting and rescuing lots of children. The presence of Childline in Nagaland, if you're wondering, wherever, if the presence of Childline is there in your districts. Right now Nagaland has 12 districts, and out of 12 districts, the presence of Childline is only in 6. Ministry is really pushing. We're really pushing hard to make sure that all the 12 district becomes a Childline district. But right now we have a presence only in 6. We have 1 nodal, Dimapur, Kohima, Kefri, Mon, and Mohokchong is the districts. So these are the districts where the presence of Childline is there. We have total population 19,78,502, and the child population in Nagaland is 2,96,775. Number of district 12, the presence of Childline is 6. We don't have a railway Childline. Maybe in the future we'll definitely have a railway Childline in Dimapur. So we'll look forward. So this is a case analysis. April 20, since last year during the lockdown and all. So this is a quick analysis. If you're looking for what is happening in Nagaland, is there any issues about children, is there any phone calls? This is what calls answered. 5,788 calls were received during last April till March 21st. So that's a number of calls people have been calling 1098, which is a very positive note actually. To look into it, that's a very good number. Which means people are desperate. People are looking for answers. They really wanted to find out if there's any way. So the team in this 6th district, the team is very busy. They are really working hard, reaching out to different people, churches, and different community leaders to go back to the communities on open house. That they do it every now and then. There's awareness program that goes on. Even now during this lockdown, lots of online activities are being organized by different partners. Childline team, and which is why the cases are really coming up. But this is just an iceberg. We're looking forward to have more cases, more phone calls. People know 109 and they need to really call 109 for any kind of issues that is related to children. So PFA, which is called protection from abuse, 49, and this few months, as you say, 200, just April, May, just within 2 months, we have 271 phone calls, and intervention cases is 269. So the average of intervention is like 95%. If we look into this, more than 95%. So, and protection from abuse is 26 cases. So it's a very good number, and this data shows that the team are really working so hard in the field, reaching out to the children's grievances and problems. The key protection concerns and major categories of cases that we have received is, if we analyze, the questions was put up to me, the effect of corona on the issues of children. So as you see, the COVID support that the team has given, especially wherever there is the presence of childline, is 3,925. So it's more than few thousand % actually compared to other cases So that includes giving support, distribution of food items, and also reaching out to the children and their families, emotional support, guidance. So there are lots of issues. So there's a lot of things that happens, and then we are really trying to make sure that every child is reached, with all the needs that we can we can provide. So in Dimapur, child beggary, then physical abuse in Dimapur and Kohima, the presence of sexual abuse. I'll come back to the case studies later on sexual abuse. The category of intervention. So if you see medical needs, 2%, shelter, 7% restoration. You see protection from abuse. During this COVID time, within this 1 year and so, you see 17%. Emotional support and guidance, 23%, sponsor 13%, child loss and missing 12%, parents asking help 4%. So this is the percentage of overall cases that we have received. So it's so alarming that 17% of this out of 100%, 17% of children are protected from abuse, and there are lots of rescue that happens. District-wise cases, if we're talking about the numbers within this 1 year and so, Dimapur 1,400 intervention cases. It's like 1,400 children, we could able to intervene, we can take off, counsel them, bring them to the center, rescue them. So the numbers are really growing up within this, especially this COVID time. Kohima is 821, Mokchong 250, Parents 736, Kefri 767, Mon 50. So you see, there is something is going on the issues of children. If we are looking at the national level impact of the phrases of childline, 5.02 million calls answered, which is within 1 year, and 3,90,000 children were assisted. However, according to the data, the numbers are less comparatively during this lockdown, because children are not able to go out, they cannot make phone calls, they're not able to interact or connect with the team members in different in their localities. They confined inside the home, but it does not says that the children are out of the problem and dangers. We'll come back to that. So the intervention cases are but more like 14% this year comparatively. So how can the community people or maybe CSOs members can make use of childline network and once in and tackle the COVID-19 related stress? So these are some of the few points that I wanted to share with you today. So the councils, the community people, or anyone can spread the message of childline, the presence of childline. We are very thankful that the police department is really initiating to carry out the message of childline. And even other organizations are really doing, the churches are really working so hard. and we're looking forward to get more support from the churches. So youth bodies, council, anyone, even you can share a little bit about Childline maybe to your friends and all that, or call Childline, if you need more information. And if you want to really help children, you can just call 109 and identify the cases and convey this message to the team. Identify and approach families and children who need help, who need psychological help, mental health due to the pandemic, and refer them to seek assistance from Childline services. Inform Childline about any affected children in their locality, for timely psychological support, emotional guidance. We have counselors in all the in all the districts. There's a presence of Childline. Even Calcutta CCC can help give counseling to the children and to the parents on these pandemic issues or any emotional support that they require. Awareness needs to be created among parents, teachers, community members, and need to identify and contribute to the well-being, opinion, formation, expression, and actions. So many children right now, they are depressed. Even adults, even for us, sometimes we get stressed, sometimes we get depressed because we're not able to go out, we are so confined at home, same thing with the children. Children are psychologically affected so much. And there are lots of stress, especially with young children. They're not able to go out, they're confined with laptops or maybe mobile phone games and things like that. So their priorities and their needs and their desire being shifted, from the real education to temporary education. So maybe the games and all the technologies away. And many parents, including me, we also struggle to face with our children time and again on this issue. So I think we should really call out and get help from 109. Any form of instances of child abuse or children in distress, seek assistance from Childline for any referral cases. So there are lots of things that Childline is able to coordinate in the districts if only people can avail the services that we were able to connect. Lastly, I just wanted to present maybe 2 cases here. This happened during this lockdown. People were pitting in. We have lots of cases that happen, especially rape cases. 16-year-old girl who lives with her mother was raped. The child has never entered a school and helps her mother in running a small shop for the livelihood. She was raped by a 52-year-old male at her house while her mother was looking after the shop, away from home. Accused has been arrested and is under police custody. So you see, what happens is parents has to go out. Even if there's a lockdown, there's a relaxation that was given to the business because the parents need to earn money. So most of the time, even parents who are working in the offices, most of them children are staying alone. Most of them children are kept at home. There's no option at all. And that's where the rape happens. People take advantage, people that are known to them, relatives, even their own step parents are really taking advantage of the children. So let us be alarmed. Everyone, let us be really alarmed. There are many things happening. You look at another case, this case, 13-year-old girl was sexually abused. Raped by her uncle, maternal uncle, aunt husband, and got pregnant. And we came to know about this when the child was 3 months old pregnant. Her parents separated, when she was small, when she was an infant, she was raised by her, and were raised by her father. Later, she was raised by her maternal aunt, relatives. And her aunt husband raped her. Even in the presence of, when they were sleeping together, because there's a small room that they had, and they were sleeping together in the same room. They were on the floor, uncle and auntie was in the bed, and even in the night, sometimes uncle will come down and rape her, and then she could not express. It took time for the Childline team to really dig out the real story, and we could really do that one. So, and I'm not talking about this about non-Nagas, I'm talking about Nagas, our own Nagas. I'm not discriminating anyone who did, but there are lots of things that is happening right now during this lockdown. If we are thinking about what is happening, it's about genome, it's not about, it's many issues are being, done, and there are lots of problems the children are facing. They're not able to go on, and inside this confined, inside your homes, they are being abused, sexually abused, they're being raped, they're being pregnanted, and then we need to really open up. We need to really open up and save these children, and rescue these children. Lastly, every kind of suffering in the world has a humanitarian perspective. And it's our humanitarian instinct, the conscience that allow us to act in such situations. How many of us were willing to go out to the next door and find out what the others is telling us? There are lots of child labor. There are lots of children that are saying, few just last month, one family has physically, inhumanly, physically abused one child in Dimapur. I know lots of us about how many of us are really concerned about that is happening inside our own houses, with our own relatives, with our own just the next door. How many of us were willing to pick up a phone call and call 109 and take connect childline team to rescue the children if you cannot? I believe all of us, if we have the heart for the child, we can do that. We can do much more. We can continue to protect the life of the children every day. So anyone can reach out. It's a lockdown, but we are not locked down. So if you see a child in need of care and protection, call 1098 and report us, report to us. So lastly, I just wanted to thank Sphere India for organizing this. I believe people will listen to this and this message will go out loud and clear that the presence of childline is very significant in Nagaland. This is our footprints, and we have wonderful team that are working in different districts. And we are willing to work together with everyone. And thank you so much, and God bless all of you.
Kelly, I'm really sorry for interrupting, but I would like to inform all the participants that Moikhan Aji the session do medium of language to Nagamis aro English is. So you can use either both the language English or Nagamis with chulaina questions kan hudio paro. Aro if you don't want to speak, you can always type the question in the chat box. So apni han questions khando kuntu panelist ke diule se kuntu panelist ke hudiule se itu chat box te dishugule do ami khan itu panelist khando they will take the questions, and then apni han aro unmute kurina pichide Q&A session thagibo. Q&A session de apni khan unmute kuriole diwo to unmute kurina bi apni khan hudiule paribo. Aro we are also going live in on YouTube. And I'm really sorry for not able to inform this earlier. So over to you, Kelly. Thank you.
Thank you, Ms. Soni. Thank you, sir. It was a word listening. Now we have our next panelist, Dr. Apon Lonchar. He is a consultant pediatrician at Nichols Hospital and Research Center, Dimapur, Nagaland. He will be addressing us on the clinical spectrum of the diseases in the children, possible issue coming to the light among the children. Sir, please, you may take your time.
A very good afternoon to all of you, and thank you Sphere India and thank you Nagaland State Disaster Management Authority for organizing this program and giving me the honor. I'll just share my screen, so just give me a moment. Yeah, is it visible now?
Yes, sir.
Okay. Yeah, first of all, congratulations to the first two speakers, Dr. Longri and Mr. Supo. I know both of them, and then they're really good speakers, so it was very enlightening. At the same time, especially when Mr. Supo was talking about the thing about how the thing is going down, the calls to childline is going down, that many people, many children, because of lockdown, because of all these things, that reaching out, they are not able to reach out and maybe suffering. When we hear about all these things, it's really distressing. So yes, COVID-19 has come in such a way that it has really impacted all of our lives, So I think we should, is it good to continue in Nagamis or English? I would really want to have a feedback before I continue. Hello?
Yes, sir.
Yeah, am I audible?
Yes, sir.
Yes, you are audible, sir.
Okay, so what is the thing, when the opinion of the house? I think, should I continue in English or is it Nagamis okay, or should I just mix it up and continue with my own comfort?
So you can communicate in both English or Nagamis.
Okay, good. So yeah, so like I said, this COVID-19 has infected everybody in all spheres, and nobody is spared. But when it comes specifically to children, the impact of COVID-19 on children is not only regarding the disease itself, not only the virus itself infecting the body, but it affects all the spheres of our life, so of their life. So that with that knowledge in mind, the topic for me today is like, since the two of our other speakers have already covered most of the things, so I'll be like more concerned and focus more on my clinical perspectives as a doctor. So what about COVID-19 and how it's touching the children in the clinics or through through the disease? So আজিকালি তো বেশিরভাগ তো one hospital বই থাকা তো I'm like free most of the time, like like everybody, lockdown is happening ঘরে বই কিনা, so মানুষ are especially children, they don't go to school, and most of the time as pediatricians, I think, as according to some surveys, the pediatricians are the doctors who are most affected by this COVID pandemic in terms of our professional life. I mean, not in other. It's either it's a good thing or bad thing. That's for the people to decide. But that is what they're saying. So we sit down, and then most of the time we don't get cases. But actually, this time of the year, the summer season, is when our OPD is not empty, but it's the fullest. We get so many children, so many sick kids during this time of the year. Mainly they come with a fever, cough and cold, sorti kasi, or loose motion, vomiting. And since school is closed down, school bond in Asia, so we hardly see any cases nowadays. But when they come, but ama baba either phone koribo nolibi tahan mon ke bacha kan luina aji boli to ahadamdi to de sugu tangor guna, either before entering hospital na agi de tahan covid to hawa de bera asne kuno bar lugina bera asne guna ekdom sugu tangor guna phuiba guna taratari de ahi thake aro phone korisi bolibi, like even if you are talking over the phone also, the volume of the voice tahan la tone boli ekdom cautious na, doctor like that's how they start a conversation. So that is very true. And then what happens ki ta symptom to ki kore ki mula bacha to sorti kasi bukhar ase, gola bikhai ase, sa solo loa duk pan nisina ase, or like something like vomiting, loose motion, diarrhea hoigina ase. That is how, like, this is the most complaint that we get in other years also when there was no COVID, and the same like this year also. But it has already the kita itukan pawo ki hobo now, like it is a COVID hone again, because see, I don't want to, like, I'm a doctor, but since today's clinical presentation, but COVID has been around for a long time, so apniya nere ama baba kan holibi kun holibi, everybody knows ki COVID la sign symptoms ki ase. So bacha kan holibi, damar kan holibi, initial symptoms is almost same only, na, fever, khasi, sordi, bukhar, sa slowly diktari. But in children, alag ekta to bishi wala hodo, loose motion, vomiting kan luina, these are the GI symptoms. So किनेगा जाने वो कि इधर कोविड ऐसे ना कोविड 19 ना किया है. If you ask me as a doctor, मुझे same to do ना digital, I'll say I don't know, because sorti kasi, the common cold, which is like basically a rhinoviral infection, which has been like going on and on for like all the time, or like influenza virus also is there. Another thing which has been influenza H1N1 and what all these things. And then there's COVID-19. So between these three, which presents the same problem, and then it can be a viral diarrhea, vomiting, loose motion, bukhar, sorti kasi na thaki na, bacha the COVID to present COVID. So itu them, how will I know? No, we cannot say. Nobody will know just by looking and listening to this. Kun babe COVID ase, COVID-19 kubo na parego. So ki grow like, what should I do now? So COVID ase. Like I said, no, cannot say. So ki grow like, then you have to test. That is what Dr. Longer has also mentioned this. Like, testing grow again, because parents they will come with this. Like their body language, the tone of the voice tells me that okay, they are like thinking this is also COVID. Even I am also thinking, but when I say into India, I say COVID situation, they say now because everywhere is COVID, we cannot take a risk, and then we should get tested. That is the only way to confirm. They're like, even in their mind, they are like, COVID testing go like, no one again one kid every party jana, it probably a review jana, that's what they say. And that's true, yeah, because some people are really following everything meticulously, masking correct, like their hand hygiene, social distancing, but human being, you cannot stay isolated, so they may be going out somewhere other. even still it's very difficult to sometimes find out where the case is coming from. So in this case, so but still after discussion we tested the children for COVID, and then even if the parents are saying no, we don't have any symptoms, when the children turns out to be positive. So what what they don't know, or we may know, but we try not to relate too much, is that asymptomatic, there's such thing as an asymptomatic coronavirus that means where adults can do almost 80% the asymptomatic or bacha can do almost 90% na. So equal symptom na apni COVID thagi as symptom na itu karni hi hand hygiene masking koribi apni nijor bi manula kun osori thaga manu normal nisna lagibo pare or apni nijor thagi na apni najani na manu dibo pare. And then another thing about thing is that when children, bacha kan to lockdown na baje school in najar, tahan nijo do choto bacha na especially they will never walk out of their home alone, even in normal times also. So if the children are positive in almost like many cases, maximum time the it is the family. Nijo la ama baba hai, tahani ani na bacha ki COVID to infection tadiwa pai. That lagai de. That's a very bad negative word to say. But bacha kan to family member ba pai biche. So family members can do positive tagi jibuli do bacha can do testing kuri lo lage na. And then if they especially kita the symptom kan bukar sorti kasen ale testing kuro lage. Why I'm like little bit pushing and emphasizing on this point is because like all of us, the participants today, all of us may know many things, but this is like my perspective, how I see it from my clinical chair and how I look at things, see things, experience things. Because I feel like we know a lot of things about COVID. Many things, like all of us has become virologists, epidemiologists, vaccine experts, this and that. But basic knowledge, all of understanding, they do knowledge to 80% asymptomatic, but 80% asymptomatic. But how 80% is translating into my clinical practice. Parents can do the testing the positive ola the bacha first testing positive ola biche parent ola parent ola na all of din biche bacha bukhar uthigina anya damde movie COVID thagiji mula bacha bi one testing anibo. That's the scenario, but it can be the reverse other way around also. So that is why we need to know we kun ki test ho lage. Itia damde pandemic ki das apni la course or kun na thagili or apni jana manu kun COVID direct effect na thagina thagili when so much COVID second wave now, like it's a good thing that it's abating a little bit now, but it's a one wave tangor adam to so manu suspect na test go like it. Test brother bishi it's a like it's a very if you can detect and test early, then we become more alert and then we can do likewise. But if you don't test and then after like few I'll show you in an eventual slide what is the importance of testing, even if you are symptomatic or mild symptomatic, knowing thing. So I'll explain that in a next few slides. So this thing, and especially if the children na bacha kan comorbid thage, comorbid means ki tangor manus ne bacha kan kun kan comorbid thage, tani high infection thage, liver problem, kidney problem, heart problem, immunocompromised HIV thage, nisna cancer treatment loi thage. These are comorbid na bacha kan na thage jule taran to juli testing rola. These are the targeted. So that's how testing works. So COVID testing by chance COVID symptom or positive or ama baba khor manugan positive contact tracing the bachakan ki testing gona positive next. Definitely in your you should contact a healthcare worker, doctor, nurse can only apni la jaga or so they kun kan thagi ase takan contact kuru. As soon as they come to me, as soon as they come to us, what we see is like if they are like come without symptom or through contact tracing, if they come or if we have mild symptom and we test them and then positive do then one categorized to bacha to symptomatic asena mild symptom asena moderate na severe ase. So mild symptom when kun go fever, cough, cold, body pain, todi kasi bukhar hota hai body pain. And we COVID like the difference is so normal todi kasi la all of different bukhar all bishi thagibo, more high fever, more body pain kan all bishi thagibo. Aro bacha kan kido kali bukhar sorti kasi na thagina loose motion, vomiting, pain abdomen itu ani luina aibo pare. So itu time our index of any other day dusra time even movie second doctor will second thought na dibo one as a viral diarrhea ठीक हो जाओगे ना COVID time my suspect हो जाओगे and then my the thing threshold for testing them becomes a little bit higher. So that's why. So और यदि अपनी testing करना positive है asymptomatic हो जाए कि तो we isolate it at home and then do just home management. Home management nothing much to do. Paras fever actually the paracetamol they cough khasi thagi jo usually recommendation to the khasi la dawai nadi sorti la dawai nadi भी कोई. So like apni olop bacha gan ge warm gorom pani or nimok olop dalina gargling koro pare aro bishi choto bacha na olop dangor gan ge do honey na like honey edo bee la kiba do so that honey bi digna olop these are home remedies that you can try out. And then of course maintain hygiene, hand hygiene kan idon maintain koro lage hotai bathing kan idon kusul guna bacha do home isolate kona rakhibo lage. Aro edu time you have to remember to monitor the temperature regularly, respiration rate, oxygen level. যদি pulse oximeter থাকিলে oxygen level বিনা চাব লাগে। কিন্তু 6 hours মাজতে বাচ্চাকে মনিটর কৰি থাকিব। Respiration rate to কিংগা monitor করব। বাচ্চা গান লা age alag হিসাবটি কারণ লা respiration rate to high low থাকে। It will be a long lecture to explain all this how respiration rate should be counted and all that. But you know, I have a YouTube channel, Apong Longchar, Dr. Apong Longchar. So there, in one of the videos, I've explained in details how respiration rate is counted, what is normal, what is abnormal. That can be done at home by any person. If you can be learned very easily. So I really encourage that you learn this. And if you are having a COVID child, COVID bacha thake, kunuma COVID বা বিমার থাকে, যদি সাইকে না হিকি না থাকে, বেশি ভালো হবে। আর মানুষ বেশি বড় কি বাচ্চাকে ডায়েট কি দিব? These are like zinc খান, vitamin D and vitamin C. These three are the things that we usually write. Other than that, mild or moderate symptom can be nolly asymptomatic can be the mild cases can be the antibiotic can ivermectin, remdesivir, steroid, azithromycin, hantan usually don't give. It's a virus, so it's just a viral infection. Yeah, maybe it's a very dangerous virus, but it's a virus. So how will antibiotic work? So I think everybody is at least clear on this point. So I myself will personally not write any antibiotic, and I also encourage that, like, you know, the knowledge dissemination is up to Dr. Khan or Libya or Abhiyan. You have to learn to, you know, either say no to the doctor or like, question the doctors and medical staff also. So that is the point, takeaway point from this slide also. So moderate COVID disease to key as now idula mild or second category to biawala to moderate to. So again mild kan la choti kasi bukhar la pet bikhala symptom thagi na bacha to jodi fast bleeding hoy jay, that means ite the upper respiratory tract opor hi infection thaga to kida niche ji jabo, pneumonia lung infection start to, that is when things start going wrong. So this is now lung congestion, now that where COVID starts attacking a person very badly. So fast bleeding start to na. Fast breathing means again age appropriate. Dui mana la bacha la niche, dui mana wa exhale wa pangsal la upor. Tangan la respiration rate normal ibi, tangan manolo high thage. Ibi aro tangan infection hoy jodi to fast breathing lo bishi hoy jabo. So idu la bi high thage bo lage. Aro jodi cardiac pulse oximeter wa size jodi to oxygen saturation to 94 বা 95 94 বা upor normally to thage bo lage. Jodi kichu niche jay na start kore jodi to that means something is really going wrong. So this is the moderate state. We have to be very aware. And if you want to do home treatment, no problem. Sita hospital take them to the hospital. And then next to which is severe over na moderate symptoms like pneumonia to severe pneumonia over sas slowly declare by guna sas loss start to or type full sentence complete ekta dita word to sas loss start to or oxygen saturation to bishi nami jabo or issue আছে লাগে না ঘুমাই থাকে ডিস্টার্ব করব না একদম খাওয়া বি না খাই যাবে আর কি তারপরে সিজার কানবে উপরে। And clinically infection sepsis মানে the whole body has become infection, multi organ disorder syndrome, that's like alag lung sigla the kidney can affect, heart can affect, brain affect, start to that is very severe COVID. So management is one ICU to manage for. Now my doctor as a doctor severe mild moderate to the moi janibole to moi gani the important as it, that's how health at least health department thakagan nurse and doctor can is very important to know and how to identify. But for public people, for knowledge disseminating, what is the importance? Importance is this: the message should be that one child or one person who is COVID positive, rapid progression ho pare, bimardo infection manuki lagichi, symptom dikhabo, serious ho jay. Pura symptom usually it does not happen. That's how disease progression does not work. Maybe a little bit fast slow but still mild moderate moderate severe so it will stepwise mild moderate identify virtually we can save a lot of children and then even including adults from getting worse to bad. So from when we can identify from this stage to this stage, idu time di mon idu get stage severe stage te jawli ba bachabo paribo. But again, another atypical signs and symptoms we thagi jai na idu sordi kasi nagena kunuba the skin maybe ita ola kan like idu rash kan red rash measles rash bisna kan ni olai bo. So these are not very common, with less than 3% cases to cover. These are also another atypical symptoms, but they like that. But and then COVID to guna be ta thagi tala thing kan idu tips of the finger kan do lal ina purple swelling kan be thagi. Idu one idu COVID la other symptoms can be ado. But the main important, like I said, it's a multi-system inflammatory syndrome in children. Messi, when I kotha apni anbi police ajibu pare, unis ajibu, and this is what we dread as a pediatrician, as a clinician. Muila bacha gan ki idu bole more phui lage because 90% of the bacha gan do mild or moderate symptom or asymptomatic in a day, or 10% gan do tadi tagan do of symptom kan ulao pare. We rarely kunuwa bacha gan na few cases, 1 or 2% of the cases will develop severe symptoms. So the one we hope are. But we do survey. Like I said, testing really important as well. This multi-system does not come in the first 1-2 weeks denied. Only after 2 to 6 weeks of asymptomatic or symptomatic COVID infection. After 2 to 6 weeks, matlab apni COVID positive ho jaye, sordi kasi nisna ho jaye. After that, hal ho jabo pare. After that, iku nisna bhalo wala nisna ho aur 2-3 saptah biche achanak pura bukhar uthibo aro body is swelling over, heart can, lungs can, kidney can be problem start to. This is multi-system inflammatory syndrome in children. Basic detail can apne janibo na lage. Holi bhi bacha kan idu antu udu kan age dibi sorti kasi wadam ni iku testing na go chart dibo ku na one iguna testing na gule mon COVID ase guna suspecting na go or all of pichi idu kan problem hola chi udu aro alag it will misguide the doctors also as well as the parents also. So we may not be able to identify when this kind of problem starts early on. So another important thing of testing every child we suspect for COVID and trying to catch them, even if they are symptomatic or symptomatic initially. So early recognition of danger sign is very important. This is the message I want to get out for the public so that they can take this message and then try to recognize this early symptoms. Fever for more than 3 days, bachado alchi lagena bishi lethargy ko jay khala nakaya saas ba dikari pass start ko jido, and we need to really like tangi lujana idu pat testing aro treatment start ko jibo lage serious not and so holibi the thing is that Savimon idu COVID ladas COVID serious ko holibi how serious is it really as a data point of view, as a from a clinician's point of view ki kore to mon also be concerned over lage na again. Of course every child, every death, every infection is very dangerous, very serious for that family, but overall we have to also look ki Dr. Lungri was presenting one slide Taiwa Kushi ki Nagaland TV last year to do bacha kan ki less than 20 years can be 3-4% ina thaki jibe, this year almost 12% 13% be uchi jai jibe COVID total COVID case in Chile. So international data, it's matching with international data also, which is showing around 11.5% of total COVID cases in less than 20 years of age. Now, case fatality, this is the, it is good news. Now, COVID is bad, but at least good news about children is that only 0.1% of those children, COVID positive, muribuli chance to 0.1%, 100 to 0.1, that means 1,000 only adult khando almost 1.17 or like 200 ki 3 জন নিচিনা তো মৰিবলৈ চান্স আছে 100 আৰু even Nagaland যদি একটা জুন টাইম যদি ওসব ডাটা তো ঠিকঠাক আছে বলি তো 100 ki 6 জন বি মৰালা টাইম বি নিয়া থাকিছে না last month and when we were having a peak in like Dimapur and all that when our cases was very high. So but compared to this thing, and then good news is that like in Nagaland to under 18 la actually COVID for morala khobor nai, so that is a very good thing, and then that's a like at least a positive point about children and COVID. And then this thing also UNICEF la data kan bhi do apni do the slide pe aro ye India la bhi Niti Aayog la member na Vicky Poro Kanba ko nisna like 3 to 4% of hospital admissions for only children. So like almost 90% of infection in children are mild or moderate agi ko nisna. So size will do bacha kan kidu iman serious for the effect na kore. So now next question to do is third wave. Now third wave IO. Yes, maybe some countries they have already entered in a third wave, like UK or some countries are there who are already starting third wave. Even in India, they are saying that Maharashtra is already third wave gonna start but the main thing about third wave and Bachagandu ko is third wave to the Bachagani Bishe effect there was almost a panic mode, and then even we were also concerned and then like of course this our state and our country they have already done it all up pediatric khan garni to monla bed strength khan or training khan dia start kuna. They are already preparing for a third wave where children may be affected more. So bachala line dikhi tahan idu infrastructure can develop or start with. But what is the thing? What is the chances? In COVID, one thing is that all experts, all our policy makers, all the leaders, prediction going. It's not like they're not making stupid prediction. They also have their data to back up, and then they are trying to anticipate the trend. But COVID is one very cunning virus which has shown to always do the unthinkable or come out very in a different way than we think. But right now, the data says, what does data say? Indian Academy of Pediatrics, that is our Monla pediatrician like union as in India stated that this variant is unlikely to affect children disproportionately in a third wave scenario. Tahanbra study guna kodo itu this variant itu nutun COVID third wave tido mon bachagan ki alag to affect kolila itu iku nai nepar. Aro sabi, this is the very interesting data. It was just last June la first week and they released ki one seropositivity rate ki one either infection kiman spread goes asymptomatic symptomatic so thaigana ta idu testing gona antibody testing gojile less than 18 years can be the 55.7%, and then in more than 18 years 63.7% are already COVID infected when as so that means here one you do asymptomatic symptomatic milaina so COVID to community just spread so in a zero prevalence to high one vaccinate herd immunity almost 70% so it was almost 60%. On an average, almost 55 plus percentage of our population is already COVID positive. So itula conclusion je kya hai? Study work or ki bachagan to be especially regarding to children less than 18 years, almost 55.7%, which is comparable to the adult. So third wave titik ta IG guli bi bachagan ki alag effect kuna third wave pro bachagan ki attack ko bado idu inia no hobo. Jodi hoise guli bi so iki lo hobo or no hobo pare. So third wave may come or may not come, and even if it comes also, our experts are of the belief that it's not going to affect our children more severely than it is usually as it is doing now. Is the conclusion to assess. So as it stands today. But our thing is that we should be prepared for the worst, but let's hope for the best. So Mohan Kwanisina COVID appropriate behaviors follow kuri aro paratak ama baba gando vaccinate kuna bachage indirectly protect kule idu Mohan encourage kuro. Now, another thing ki hota in news day article alpha, beta, gamma, delta. What is this? Right? These are the variants. Not COVID like the virus to say China were first Wuhan they identify gonna pura world is spread quickly. Now, if you spread pretty what happens is that this virus always mutate, even or evolves. Evolve gonna mutate. Nutun olay. নতুন ওলাদো বেশি ওলাই না দেখলে তুমি আলফা বিটা গামা ডেল্টা এই চারটা পাঁচটা একটা স্ট্রেন নতুন স্ট্রেন these are called variant of concern because it one কোনোবা তো মিউটেট করে না বিয়াওয়ালা বি হবো কোনোবা তো কোনো না মরি যায় কোন ভাইরাস তো তাকে খতম হয়ে না যায় হলবি ইতু চারটা তো দিস four variants are the ones who are like very dangerous আর ইদু কারণে আরো বেশি যাইছে বলি তো ফিউচারে আরো বেশি ওলা তাহলে হতে পারে তো কি কারণে ডেঞ্জার আছে বলি তো these are the things this delta strain, especially India, delta strain do bishi paije guji. Our last time second wave to actually tagala or kotomoi tagala wave to delta wave bishi push kona tajina kwaze. So kili mane delta is increased transmissibility, almost 50% more transmissible in every way. Last time so actually manu low paije the pat kona transmit to. Or it one lung China they can attack the lung more like strongly, and then also tahan vaccine babi idu escape pro vaccine digina thaga manu bi delta strain ba affect koise bole to itu aru vaccine digina thaga to kam na thaga hobo. These are the concern, these are the things that the scientists are looking at with concern and with itu ba manose ke khoi koi dia jay. So delta strains are the deadly variant of coronavirus first detected in India. Now India the pila the India de ulaichi which is the 80 countries law pore world it was triggered present, and then the UK or the US can be almost 90% of the strain in UK is like this delta variant only, and then in India or Singapore can be dominant strain. So again another thing is the delta strain green amount is key as you wanna try with them or it mutate or delta plus the now delta plus to key as you are with delta wala double mutate or all of change it is become a new strain that is emerging. So as of June 28th, we keep as a doctor, I don't usually want to, present data or the facts and numbers without having a clinical evidence. More usually they have research papers, which is like, so when I say something, I want to quote that paper because these are already alag doctor can peer-reviewed papers can take. So these are like, usually, but nowadays with this corona thing, news and facts and findings become so rapid. Of course, Dr. VK Bol is a very noted pediatrician, is a member of Niti Ayog. So tahan ba ko ini nido nako ba tahan ni research holi tahan ko the paper law present guna nako kini mani that still working on that data to present. But from what he said on an interview on the 20th of June, 51 cases of Delta variants had been reported, Delta plus variant. It is 12 states. Just few weeks back, it was only on 10 states. Now it has come to 12 states. So this is another variant that we are very looking closely at. And itu Delta plus variant, third wave to this is something that they're looking at. But that's the news. So whether this additional mutation in Delta variant is associated with increased transmissibility or excess in severity of disease or any adverse effect on vaccine is not established. So it gets up to high as it, but still it was no proof. So that is what they are saying. But our concern ki itu wala nutun Delta strain Delta plus strain guna itu to kini awud karawala na biawala. That's why only they are looking at it with concern. But vaccine iman banai na alag vaccine like Covishield, Covaxin, Sputnik, Moderna, Pfizer vaccine itu one सब banai na so itu one to agila variant get banai na itu one mutate kona ulai na IC boli to one vaccine doina thaga ro ide vaccine di thaga to kam pro na pro. Now that is the main concern because only vaccine is the only way that can stop this pandemic. So that we all know. So clear. So what they are saying. So what they are saying is that the good thing is, like, hopefully it should hold true. Covishield and Covaxin works against the variant of SARS-CoV-2, alpha, beta, gamma, delta. It is sopra halva gam. This has been established, and this was quoted by Dr. Bhargav, who is the director of the ICMR. So that is the silver lining, and then that is the good news about as it stands today. So future the key over but let's just pray and wait. But hopefully these vaccines will be able to work very good against this also. So it will cover that. Now that is the thing, like about this Delta virus and variants and vaccines and how, like, moderate, mild and care. Kunuma situation can take this. Maybe you as a civil society organization, NGOs, you may be dealing with the families in the grassroots level in the day-to-day basis. So these are questions that the parents ask me also, and these are relevant things that I feel you should know. So even if I'm taking a little bit over time, I hope you don't mind. I'll try to go over this little bit faster. There's just a few more slides. But I feel that this seminar should include this also. So I've included some few common questions. So if a child or parents is COVID positive, then how to isolate? Now, if you ama positive, bacha baba positive, bacha bhi positive, then ekta khote thake isolate kurna na kuro. Ito kotha to ulai jay. So ama to jodi positive hoye, bacha to bhi positive aje boli to tai din to alag isolate kuro na lage. Ama to bishi serious na ICU thake oxygen lagi aje boli to bacha chutu bacha hobo na paribo. Itu karne itu to alag kotha. Itu dan itu separate kuro lage. Ama to bishi sick nai, baby to chutu aje breastfeeding kuro aje. Ikilo rakhibo di. It's okay, but that is why since both of them are positive. Jadi ama positive aje, bacha to negative aje. So itu dan ki kuro. So obviously bacha to negative aje, amar wa lagai dibo pare na. Itu karne itu situation to olo confuse ki kuro. Ama to jadi bacha to jadi bishi chutu aje breastfeeding kuro lage. No libi khor manu saboli pun na or sa manu libi chutu bacha ran to chinya sabo inya thagi je boli to ama positive libi bacha ki rakhina breastfeeding kuro lage or sabo pare. Libi ama to mask kantik lagaw lagi, hand hygiene maintain kuro lagi, aru paratak bacha ke sab ichi do diri ne after breastfeeding do sab ichi do alag rakhina separate kuna aru paratak tolo time spend go aru kuro. Because the longer you, even if you are staying together, our time duration will be important ita. Aru didi bacha to positive aje, ama baba to negative aje le kina kuro. That's the problem. Another scenario because choto bachan ki to taan ki isolate kuna taan ki alag te bathroom thake libi, room separate thake libi. One touch nukuna khana supply go partially chotu bacha ke you cannot keep them alone. So what to do during that time? The parent has to take care, but make sure that the parents are having proper PPA, wearing proper protective gear, and then help the child. But if the child bacha no 10, 11 years suji ta nijo take care ko the bacha no smart khani thake digeli ina hoji to tahan ki isolate kuna dur by through phone nolibi dur ba kotha goina monitor ko ajili to osor na jay bhat. Upay natagala situation to the Jaishi will be it one precaution in a Javiko. So that I think hope clears some of the scenarios that plays out. Now another thing is, can a pregnant woman pass on SARS-CoV-2 COVID? Amma do pregnant thagi tai COVID positive huji boli do itu baby pet te thaga de COVID to buncho parbo na parbo na hudishi boli do এতিয়া তাক কিন্তু এভিডেন্স কোনোবা বাচ্চা কিন্তু আমাৰ লো পালো লো বেবি গান কোনোবা কোভিড পজিটিভ আমাৰ লো পাইছে যদি ইমিডিয়েট টেস্টিং করলে কোনোবা বেবি গান তো পজিটিভ ওলাই ಇದು some case reporting are there but this is very less না বেশি কম দিয়া যায় এতিয়া তাক কিন্তু হয় সব বুঝি বলি তো পাস যাও ইনা লাগি এতিয়া বি এভিডেন্স নাই তো যাব পারে হলি ইটস নট ভেরি কমন তো বেশিরভাগ তো ইকো নই নাই আমার তো পজিটিভ বলি বেবি তো নেগেটিভ থাকিব পারে so that's the message so that's why you have to know this also. So another thing, is it safe for a COVID positive mother to breastfeed? Yes, the answer is simple yes. But one is na ekilo thagi ase na amado positive na bacha do negative bagi boli breastfeed to continue kori breast milk for COVID to baby la bitori na jabo. So idu kane aerosol generation hoy to mask kan lagai na baby di breastfeed koro pare. Can a pregnant woman take COVID vaccine? Yeah, it will be another question ki vaccine kun kan lo na kun kan lo na no, not diabetes can tagile lowana na idugana say you problem tagile lowana everything is yes but there's one category where pregnant women can do either the vaccine na dibi or basically be special category dibi guna ekta thagise but 25 June just few days back the Union Home Ministry has made an announcement through ICMR ka dance study guna kuji ki pregnant women ki bhi the COVID vaccine dibo pare. So that is a very good news because pregnancy as a condition, pregnant thage then manula immune system to low ho jay, all weak thage. So then the COVID vaccine do, mane tahan ki bhi bishi important ho jay. Na comorbid ikta thaga nisna do. Comorbid is a disease. Pregnancy is not a disease, but into time the pregnant thage then the immunocompromised thage weak ho jay na thage. So then the pregnant woman can COVID lagi jay ulo tahan di aro COVID pa serious ko le high chance ho jay. So bhi tahan ki do bacha ki effect ko le guna vaccine do all of caution na digna thaga do either research guna study guna koa ki it's safe so now you can give so it's a yes so this is the latest change in the COVID kun kan gi dibo pare na pare this is the latest change so what to do when a pregnant lady becomes COVID-19 positive so I got some questions kunuba manon mugi bi hudise ki moi kiba huina thakise ki moi pregnant huina thakadam de moi COVID lagi jese ho or some of them had taken COVID vaccine ki moi pregnant thakadam moi COVID na jani na COVID vaccine dise edu bise all of them biche moi pregnant ase janisi to kina bro na terminate to na ki ene hodise but no the answer is no even if you have taken COVID vaccine without knowing you were pregnant or apni pregnant thakadam de COVID lagisi bolbi bacha ki edu effect hone to chance to bishi kom dia ase aro edu pregnancy to biya hoina jawolila chance bishi kom dia ase so don't terminate pregnancy don't worry continue the pregnancy with strict monitoring all bajabi and then pray that it turns out well so that is the answer so what to do when a COVID positive mother delivers a baby so two questions this is the last question in the slide so this is a little bit complicated question I don't know how relevant it will be for the general public but since some of you may be engaging or kunuwa apni health center kan lo ikulo collaborate kuna kam guna kura dam di ita janina thagibo la do judi amado COVID positive na baby to paisile ki pro lage do dande so that is the confusion so if the mother is COVID positive or suspect kuna baby paisile the baby the first serious pa bimar ase na nai sabo baby to judi bimar thage na premature birth hoje na judi kiba problem ligina ICU de admit kona treatment kole ulai je to baby la ICU de shift ko SCNU then baby ki testing go baby ki bhi testing gona jodi baby ki bhi positive polai je boli do and ICU je alag ita baby kan COVID positive kan ke rakhe boli lag jaga thake tadi tai treatment ko lagi only baby do negative ase or suspect ikla ase boli do COVID suspect area de rakhe boli lagi because janam howa bichi bhi next over the 14 days the baby may start developing symptoms and signs so you will know so you will treat it as a suspect not the positive and then keep the baby away from the positive baby kan lo separate kona alag jaga de rakhina treatment ko and then next scenario is that amount of positive ase baby do bajoli baby the bimar nai stable nai need to kantika khabo pare ase do amado saw lagi amado jidi serious pa bimar nai tai bi stable ase do COVID positive mother COVID ki baby to COVID positive ase ekilo thagibo pare ba COVID suspect ase jidi amata jindu alag te rakhibo ekilo ward te rakhina breastfeeding koro pare boli amado bimar ase guna amado nijo ICU de thagi ase boli do baby ki postnatal ward te rakhibo lage but idu COVID ward kuna alag thake tadi rakhibo pare. So that is how the thing. That's a small glimpse. There are so many things that we can discuss and talk about, but I hope you answer in the question answer session. But I I've tried to cover a lot of things which I feel is important for you all. So COVID everything always negative about COVID, everything negative. From my experience and from my interaction with my patients and my other people also, I don't think it's always negative only, because I see that many family, yes, of course, Mr. Subu has said about the bad things about Khori Thagina abuse report Corona Paralavi, but at the same time, I find that many people are getting time to spend good quality time with their children, able to interact, able to spend time, teach them many things. Khori Mother Kule Kandi Thagya. So I hope that at least we are the negative when we come out of this COVID thing, which I believe one day we will, very soon, then we will come out with a positive attitude, with a positive family bonding, which will carry us forward in the future for a better future. So thank you for your patient listening. Thank you.
Sir, thank you for your insight. Indeed, very much required in the present times of pandemic. Now I invite our last panelist, Mr. Marant Lambot, Senior Manager, World Vision India, Nordic Zone. You will be sharing experience based on the project World Vision India has undertaken for the child welfare and safety. You will also be sharing on the current project that is undergoing in the Longland district on community engagement to create a caring and protective environment for children. Over to you, sir.
Thank you. Am I audible?
Yes, sir, you're audible.
Thank you so much. Am I audible?
Yes, sir.
Can I share my screen, please?
Yes, sir.
Good evening, everyone, and respected panelists and speakers today. I'm so privileged to be part of this webinar and have this wonderful opportunity to share something about World Vision and also on the topic that is given to me. I hope my slide is visible to all of you.
Very much, sir.
And I am not very sure how many minutes I can take, because as per the time we are supposed to go till 4:30 and just a few minutes are left. So I just want to know before I proceed how many minutes I can take. May I know, please?
Sir, you can take 10 to 15 minutes for your presentation.
Thank you so much. I will make it as short as possible, as brief as possible. And thank you so much, Sony. Thank you so much, Spare India. Thank you so much, Nagaland SDMA, for organizing this program. And I hope this program will be very meaningful for all those who have joined. I can see 108 participants, and I really want to thank everyone who have joined. And I am here feeling little nervous because we have had such a wonderful session from all the three speakers, and I wish we have more time to listen to them. But since we have another topic given to me, which I will be covering, maybe I'll try my best to make it as short as possible. Before we move on, I just want to tell that I am working with World Vision India, and I hope all of you might know what World Vision is. World Vision is a Christian relief and development non-government organization working in India for the last more than 50 years, and we have been working even in the Northeast for many years now. And I just want to start by just giving an updates on COVID before I move on to the topic. Just run through. This is what we have been doing in response to COVID pandemic, and this is the COVID 19 second wave response, and I'm just going to run through a bit fast. And we are focusing on strengthening healthcare system, providing PPE kits, pulse oximeters, oxygen concentrators, and beds. And these are the figures that is given. I will not read all of them because of lack of time. I'm going to run little fast, please bear with me. This is what we have been doing in this country, and we are also providing psychosocial support and building resilience, and also involved in vaccination awareness program. We are carrying out along with the government and taking out awareness sensitization program in different parts of the country, and we are also doing networking with various stakeholders in responding to this pandemic. Now this is where we are in Northeast. In the Northeast, we have got very different projects implemented in different states. You can just see how World Vision is operating in the Northeast, and we can also see one out there in Nagaland, and we had another one in the district of Mon for 18 years, and we recently wind up that project, and then we started another one in Longlang. And I am based here in Guwahati and supporting all these projects in the Northeast region. And this is the map of Nagaland, and we had Mon ADP, which actually started in the year 2002 and wind up in 2020. And we had a wonderful achievement there in Mon district. And we also had very beautiful project in Dimapur, and Mr. Shibu knows this project very well. He was somehow associated with this project, and Dimapur ICLRP project was there for quite some time, and then they did a wonderful job there. And we recently started Longlang ADP in Longlang district. This is the highlights of World Vision projects in Nagaland. Let me just quickly talk about our strategy, and these are the three strategies that we have for the whole country. We want to first of all increase the number of children who are well nourished, the age group of 0 to 5. Second, we want to increase the number of primary school children who can read. Number 3, we want to increase in children who have positive and peaceful relationship in their families and communities. So these are the main 3 objectives of World Vision India in our projects. Now coming to the question that is given to me, and we have been learning a lot of new things even as we go through, even as we had this lockdown due to the pandemic. We could not continue with our usual activities, and there was a time when we all had to do a brainstorming of how can we continue our work. And our work is nothing but to take care of the children in the communities, and many of them are vulnerable children in the remote villages. How to take care of them, meaning how to keep monitoring them just to find out how they are doing. So the idea came up from different places, and some ideas of course came from children themselves, and the idea was to have the monitoring of children over phone, through phone, because phone was something that we had. Even in the remotest village we had phone, even though the connectivity is challenging in some of the places, but people did have phone in their hand. So we thought we will come up with the monitoring of children over phone, and we started doing monitoring over phone, which is very effective. And we also came up with an idea of virtual children program, where we ask children to participate in various activities. As we have heard from the other panelists about the programs that we can organize among children, we also did many programs, beautiful programs for children, along with children, and they also expressed themselves about their feeling, about their plan, about their understanding, about small children telling about what they understand by COVID, what they understand by lockdown. So small children were able to express themselves and just tell it, articulate it over this virtual program. And we also had conference call, and this conference call with the children, talking about their communities, their children related activities in the communities. And we also had some programs for the service providers. We had some projects along with UNICEF here in Guwahati, Assam, and we have taken some virtual and telecall with Anganwadi workers and other service providers, just to find out how things are going, whether they are able to provide those services which are necessary for the vulnerable children, for the communities. And we also recently, in partnership with Spare India, we implemented One Nation, One Ration Card project, and we had done a very beautiful project in Dimapur where we had the public announcement. And this was something which was implemented in Dimapur recently, along with the Food and Civil Supplies Department, Government of Nagaland. Let me just move on. Maybe I'll move a little fast, and if you have any question, please do park your questions so that we can take your question at the end of the presentation. Now, with reference to Mon district, we had lot of stories, and I am really sorry I will not be able to tell all the beautiful stories that I have from Mon district. After working there for 18 years, of course we have invested a lot, maybe somewhere about 50 to 60 crore, and we had good number of dedicated staff who invested their lives, their time to be there in Mon and serve these communities. We identified livelihood as one of the major concern for those vulnerable poor families in those remote villages. So we went with an economic development project to address those issues related to livelihood and take care of their children well-being, so that the parents will be able to take care of the needs of children, education of children. So we have promoted cardamom plantation, we have gone for livestock, we have gone for introducing alternative source of income through small businesses at the village level. We also did capacity building for all those farmers, all those villagers in the remote villages, building their capacity so that they are able to cope with the new changes that is coming and taking up new source of livelihood. And we also implemented some nutrition health project, and we had this beautiful model. In fact, we have a lot of technical proven model implemented in all our projects. We also implemented in Mon this model called time targeted counseling, which is very effective, and this was highly appreciated by the district administration. And even after we phased out the project, because of the impact that we were able to create among the lactating and young mothers and on the children below 5, the deputy commissioner asked us to scale up for the whole district of Mon. So we had trained the frontline workers, and we have printed and given the flip book, which was also sponsored partially by the district administration. So this is something that we have done in Mon on nutrition. And we also had a lot of programs for the frontline workers in this project. And we had educational project where we supported students from very poor families who are not able to pursue their studies because of their family condition. We supported their educational education, and we have many youth coming up doing very well, and they are most of them are able to complete their post-graduation, graduation, and many of them are on job now. And we have a lot of stories from Mon, and there is one incident that I just want to quote. When we went to the village and asked the old people in the village, what is the impact that World Vision has created in your village? They were having little difficulty to tell how it has impacted. Then we started asking about the tithe in the church. Then they said there is a huge vast improvement in the tithe in the which we receive in the church. Then we asked them, from where you got this money? And then the villagers started talking about their cultivation. They're talking about their source of income. Then we said, from where you got those sources, from where you got all those saplings and agriculture inputs? Then they said World Vision provided. So what I'm trying to say is, we have seen villages transforming in Mon district, especially in those villages where we have invested 18 years, and we have a lot of stories to tell from Mon. Let me just move on to the next slide. I'm just getting stuck. I'm not able to move. I don't know what happened. I'm so sorry. I'm having some technical problem here. So sorry. Maybe since the time is less, maybe I should stop here. Maybe I would love to have some question. If you have any question from your side, maybe let me just stop here because I am having some problem. Okay, thank you so much.
Thank you very much, sir. So with that, we have come to Q&A session. So if any participants, if you have any questions, you can unmute yourself or you can type them into a chat box.
I see one question type in the chat box.
Sonny,
Yes, sir.
I've seen that question. Can I just answer that?
Sure, sir. Please go ahead.
So this our brother is worried about the COVID test. No, he says it might injure his brain. Na, ki question? Yeah, brain damage plus. Nah. So brother, we have done around 226,000 tests in Nagaland very safely. The nasal swab is a very thin plastic, flexible swab, no? And it doesn't, I mean, of course, you feel a little uncomfortable when it's poked into your nose, but nothing will happen to you. Don't really worry about that. We have done it very safely for all the testings. Even I have done it around 9-10 times, including day before yesterday. So don't worry, really don't worry about it. And we have no cases till now. You know, it's a very small, flexible plastic swab. You don't have to worry.
Dr. Longer, if you don't mind, if I just, I mean, whoever has asked that question, I just want if they can answer regarding, maybe he's talking about that, because nowadays they have already launched in the market regarding home testing of this thing also, antigen.
Okay.
So maybe his concern was that, or just to clarify, you know, that's.
It could be that also.
Yeah.
So basically, even for rapid antigen test before COVID self came, we have done it ourselves also. It's quite very simple and it's quite safe also if you follow the instructions properly. So even if it's COVID self, the self test you're doing, it's okay. You can do it yourself. It won't injure you unless you're very, rough and all that. But the thing is, even if it's negative from COVID self and you have symptoms or you're a high risk contact, you still have to do a RT-PCR test. Our COVID self is not very sensitive as of now.
Okay, thank you, sir. So since we are running out of time, now I would request the panelists if any of you would like to give a final remark.
Yeah, I'll just take one moment. Thank you. It's a very good program that you've organized, and like I said, I'm very thankful for you for organizing things. One thing I have also presented in a few other forum also regarding COVID, and then especially when children also. So one thing that I find is that like everybody, like I said, knows about COVID, but our basic understanding of the COVID itself and then how vaccines are working, how it's done is still a little bit on a gray area for many. So vaccine hesitancy, which I'm seeing a lot from, and then all of us know okay, how, especially in the rural areas, it's very difficult to make them understand. So as a grassroots level workers, for people who are working in the grassroots, I would really this thing, my view and then my advice or I don't know, my opinion should be that we should try to ourselves understand the basics a little bit better and then try to present it in such a language and such an approach. We should try to localize our approach according to the community that we're addressing to, not just like take down my PPT or some PPT from some presentation from somewhere and then just go and then explain it to them according to what's written there. So that would be my thing. Another just a small thing that I wanted to add. And thank you so much again.
Yeah, there's a question that has popped up for me. So I just wanted to respond to Mr. Or I don't know if there's a miss of Mr. Kikro. So the question is, let's take an example of a child being rescued by your team, but eventually no one comes forward for that particular child. So how does the team go about in that kind of situation? So what happened is like when a child has been found or rescued, within 24 hours, we, report to the CWC or we present the child to the CWC, which is Child Welfare Committee, which is present in almost all the districts of Nagaland. So what happened, then the CWC will recommend Childline or anyone who brings a child to any recognized or registered children homes or maybe homes that is run under the Social Welfare Department. In almost all the districts, one good thing is there's a ACPS. So they take in the child, and within that 2-3 weeks of time, or maybe a month, it takes sometimes to find out their parents, guardian. At least he or she is a human being, so he comes from somewhere else. So the team supports or help, and we have DCPO team, we have a Childline team, we have CWCs, so including the administration. So all together, we try to find where the child comes from, where are the parents. So within just 2-3 weeks of time, we definitely finds out the relatives or the guardians and all that. Later on, once we find the genuine guardians or the parents, we hand it over the child. Not we, but CWC in our presence, handed over the child to the family members. So that happens. So till now, and in case if a child is found, for example, newborn baby is found in hospitals or someone has picked up the child from somewhere else. So what happened is if child have found such kind of children where we are not able to locate the parents or any relatives, then Childline give it to CWC. CWC will recommend that to the adoption center, and adoption center obtains NOC for adoptions from the CWC, and that's how the child goes for adoptions within a month or maybe within a year. So there's a lot of process that happens, but every child is counted as a very important person in life, and then we make sure that child finds their home. That's a core solution that we always look forward, not an institution, but we make sure that 100% the child finds a home to live, the families or the relatives or the village people, not the institutional care. But the last option is an institutional care. If the child doesn't have any guardians and there is no one to be, connected with, then we submit the child, or CWC will recommend a child to be in initial homes or maybe orphanages or maybe any registered home. Thank you.
Thank you very much, sir.
Excuse me. May I say something?
Yes, sir.
With the permission of our moderator, I would like to acknowledge the presence of Deputy Commissioner Mon District, Sir Thavasalam. Sir, are you there? Sir, thank you so much for joining. Hello.
Mr. Marin, yes, I'm here, Mr.
Yeah,
Marin.
can you
Thank
say a
you.
few words, sir? We are so glad that you are here with us. Thank you so much for joining. It will be so nice to hear a few words from you, sir.
Thank you, Mr. Marin. Thank you for the very informative presentation. I mean, just wanted to acknowledge all that you've done for my district here, and the continuing work, the last piece that we had done on maternal and child health nutrition, and the flip books that are being used by Ashas and Anganwadi workers across the district. Thank you so much. There's been a permanent change in the lives of all those people in the intervention villages. It's just that we were sad to see where this will go, and we request you to come back if possible to the district. Yeah. Thank you so much.
Thank you so much, sir. Thank you. Thank you.
Thank you very much, sir. Great. I thank all the panel. Yes.
I just said thank you. Thank you for the opportunity, Ms. Mere. Thank you.
Okay. Thank you, sir.
Thank you so much, sir.
I thank all the panelists for giving your valuable insight on the different topics. So with that, we will turn time over to Sphere India.
Thank you, Kele. Dr. Longri, do you have any final remarks to give from your end?
Okay, thank you so much for this event. I mean, it's not the first time. You have been doing a wonderful job, all these few months. I hope, there are 100 participants today, more than 100 actually, So it's very encouraging. But I just want to request all the participants to please do this. Please reach out to at least 10 people, everyone, whatever you have learned today. 10 into 10 is at least 1,000, or in social media or anywhere. We have to reach out, we have to amplify. Otherwise, I think the knowledge should not stay with you. We have to learn, we have to share and all these things. So I please request everyone to share this. And thank you so much for having us. Thank you.
Thank you, Dr. Longri. Now, before wasting much time, I would like to propose a vote of thanks. Thank you to all our panelists, Dr. Longri, Dr. Apong Longcha, Mr. Subunengba, and Mr. Marin Nampoy. It was indeed a pleasure to have you all on board for this session. Aji, you all have covered all the important aspects related to health and safety of children during the current surge of COVID-19. At this time of pandemic, the COVID-19 has led a lot of changes in our normal life, like schooling be down operation, but school be attend grown operation, everything like they have to do it online, where some children are unable to get access to internet and phone. So that kind of issues where children are unable to get services, health services, which they require, that kind of situation. At this time, this is a need where we have to, jointly work together to fight. So for this, we also have a very good number of participants from the NGOs, volunteers, and individuals who are interested. So I'm really very grateful to each and every one of you that for making this session a success one. And I believe that today, whatever knowledge and information that we have get from the panelists, we will not keep it to ourselves, but mohan sob edu ekjon ke educate kruo aro jai kina aro how we can protect the child mohan jai shikule aro kwanishna distressed children kan daki shikule how we can address it, how mohan kina tahangi help role paro aji mohala panelist Mr. Subunen Babari bishi bhal rakhuse aro helpline number bi dishe. To I hope each participants can be to North Korea se aro in the future if any situation comes up, we can always help grow on through this helpline. Aro when it comes to like health condition COVID related to symptoms and all Dr. Apong aro mental health aro psychosocial health dewi balrok widishe Mr. Dr. Longri aro Dr. Apong bra. So I hope itu bra mohange bishi help kruo. And then not forgetting to thank the NSGMA team. Thank you so much, Kele, for moderating the session very well. Indeed, you did a very great job in moderating this session, and it was also a very great pleasure to have the Deputy Commissioner of Mont. I am Muitala Nambi Barakole Nabare. Olivi, sir, it's indeed a very great pleasure to have you on this session. Aro, all the participants, thank you all, thank you so much, and thanks to my colleague Gohar, who have been helping us with the technical issues. Aro requesting Sopkaro request Grace that next session Devi Aro sessions contact you do Aro join Kurina learn more from the panelists Aro sessions to depending on the needs Saina depending on the needs one session that you would or next session they will join Kuruyuguna. And then one more thing. I also got the information that the third wave is probably will be like bachahanke bishikya kuruguna itulate he understanding that jitak itude until today's session. I'm convinced that that is not very like proved nohoy, and then that's not true. So we can see that how like this kind of session is really very important, because at in a time they do social medias can they meets can be bishithage. So this kind of platform will help us to interact with expertise. Aro expertise can be interact rina osado kiase misado kiase to hambi janiole pare. It one of the sessions hando bishi important as say in a movie. I'm also learning. So requesting again to all the participants to be a part of the coming session. With this, we will end the session. Thank you all. Thank you very much.
Thank you so much, Soni. Thank you so much.
Thank you, Maran sir.